Welcome to Sato Cario Online Nursing channel. In this video, we are going to discuss 15 multiple choice questions from Respiratory System Medical Surgical Nursing subject. This channel is mainly getting popular day by day only because of you all subscribers. Daily I am getting lot of messages, I am getting lot of calls. Many people are behind the success of this channel. Just only 5 more days for AIIMS New Delhi exam, September 2018. So I wish all the best for all those who appear in this exam. And in the next 5 days, we will post more videos for you all, and we will be standing with you all for the entire preparation of your exams. Let's go to today's video. Before going to today's video, you have if you want to join in our WhatsApp group AIIMS Learners, please send request to this number. We will add you in our group. Lot of discussions are going in that WhatsApp groups also. Already we have two WhatsApp group. The two WhatsApp group also get overflow. So we have started a third WhatsApp group for the AIIMS aspirants and AIIMS learners. Let's go for today's video. Those who have not subscribed yet, please subscribe our channel, Set to Career Online Nursing channel. The first question of the day is, which of the following is a common symptom of lung cancer? Option A, cough or change in a chronic cough. Option B, wheezing sound on inspiration. Option C, foamy blood tinged sputum. Option D, dyspnea or exertion. Which of the following is a common symptom of lung cancer? In this four, the right option is cough or change in a chronic cough. Let's see the rationale for this answer. Smoke and the carcinogen irritate the respiratory mucosa, which in turn lead cough and change in chronic cough. So this is the rationale for the right answer of question number 1. Let's go to question number 2. An adult patient is scheduled for a tracheostomy. Which of the following nursing action is priority for this client? Option A, insert a Foley's catheter. Option B, establish a mean of communication. Option C, prepare the bowel by administering enema until clear. Option D, start an IV line. So guess the right answer. An adult patient is scheduled for a tracheostomy. Which of the following nursing action is priority for this client? The right answer here is to establish a mean of communication is the priority for the client who is scheduled for tracheostomy. Why we choose this answer? Preoperatively, the priority nursing action for the patient who is undergoing tracheostomy is to establish a means of communication, because the patient will not be able to speak after tracheostomy is performed. So that is the right answer, to establish a means of communication for the patient who is scheduled for tracheostomy. Question number 3. An adult man has a tracheostomy tube in place. Which of the following action is appropriate for the nurse to take when suctioning the tracheostomy? An adult man has a tracheostomy in place. Which of the following action is appropriate for the nurse to take when suctioning the tracheostomy? Option A, use a sterile tube each time and suction for 20 seconds. Option B, use sterile technique and turn the suction off as the catheter is introduced. Option C, use clean technique and suction for 15 seconds. Option D, discard the catheter at the end of every shift. The right answer for this question, as you guess, the right answer here is, let's go for the right answer. Use sterile technique and turn the suction of catheter as the catheter is introduced. Why we need to choose this answer when other three options are also there? Let's see the rationale here. The rationale here is suctioning should be done under sterile technique for not more than 10 seconds. The suction should be off as the tube is inserted and applied intermittently as it is withdrawn. So this is why we choose this option as our answer. Question number 4. A 52-year-old male client is admitted with chronic obstructive pulmonary disease. The nurse notes that he has neck vein distension and slight peripheral edema. This sign indicates the onset of, let's see the options. Option A, cardiogenic shock. Option B, cor pulmonale. Option C, left-sided heart failure. Option D, pneumothorax. Let's see the question again. A 52-year-old male client is admitted with chronic obstructive pulmonary disease. The nurse notes that he has neck vein distension and slight peripheral edema. These signs indicates the onset of. The right answer here is cor pulmonale. Cor pulmonale is the right answer. The rationale here, cor pulmonale is a condition that causes the right side of the heart to fail. It is manifested by jugular vein distension, which is known as distended neck vein, and peripheral edema. So we choose this answer over the other three options. Next question. The priority nursing diagnosis for the client with tracheostomy. The priority nursing diagnosis for the client with tracheostomy. The four diagnoses are given here. Option A, pain related to tracheostomy. Option B, impaired verbal communication related to tracheostomy procedure. Option C, ineffective airway clearances related to increased tracheobronchial secretions. Option D, in risk for impaired skin integrity related to tracheostomy incision, which is the priority nursing diagnosis for the client with tracheostomy. The right answer here is ineffective airway clearance related to increased tracheobronchial secretions. Why we need to choose this option over other three? The rationale here, ineffective airway clearance is the priority nursing diagnosis for the patient with tracheostomy tube in place because it is important to maintain airway clear from tracheobronchial secretions. The ABC, the airway breathing circulation protocol, assists the nurse to prioritize airway clearance. So we chose the ineffective airway clearance as the priority nursing diagnosis here. Next question. A 65-year-old male client is admitted to hospital with a diagnosis of pneumococcal pneumonia. The client has dyspnea. The client's temperature is 101 degree Fahrenheit. Respirations are 34 and pulse is 94. Bed rest is ordered for this client primarily to option A, to decrease metabolic needs. Option B, to prevent development of atelectasis. Option C, to prevent pneumothorax. Option D, to promote postural drainage. Which is the right answer here? A 65-year-old male client is admitted to hospital with a diagnosis of pneumococcal pneumonia. The client has a dyspnea. The client is having temperature of 101 degree Fahrenheit. Respiratory rate is 34 beats breaths per minute. Pulse is 94 beats per minute. Bed rest is ordered for client primarily to, the answer here is to decrease the metabolic needs. Let's see the rationale here. The client is having difficulty in breathing and meeting the oxygen needs. Providing bed rest will reduce the metabolic needs of the client, so the oxygen needs also reduced. Let's go to question number 7. Removal of the entire lung is called as option A lobectomy, option B pneumectomy, option C wedge resection, option D segmental resection. The removal of the entire lung is called as, the right answer here is pneumectomy. The rationale here, pneumectomy or also known as pneumonectomy is a surgical procedure to remove a lung. Removal of just one lobe of the lung is specifically referred as lobectomy. Removal of just one lobe of the lung is specifically preferred as lobectomy, and that of a segment of the lung as wedge resection, and the segment of the lung is removed is called as segmentectomy. Segmentectomy. Let's go to the next question. Sputum specimen for culture and sensitivity should be option A anytime after pursed lip breathing, option B upon awakening with deep cough, option C in the morning after breakfast, option D before bedtime with a deep cough. Listen the question carefully. Sputum specimen for the culture and sensitivity should be collected anytime after post-sleep breathing. Option B upon awakening with a deep cough, in the morning after breakfast, before bedtime with a deep cough. The right answer here is upon awakening with a deep cough. So the sputum specimen for culture and sensitivity should be collected upon awakening with a deep cough. After getting up from the bed, ask the patient to have a deep cough and collect the sputum for culture and sensitivity. The rationale here, the sputum specimen should be collected upon awakening with a deep cough and expectoration of sputum into a container. This gives the perfect result for analysis. Ninth question. The most common early symptom of laryngeal cancer is option A dysphagia, option B pneumothorax, option C airway obstruction, option D hoarseness of voice. The most common early symptom of laryngeal cancer here is hoarseness of voice. Hoarseness of voice is the most common early symptoms of laryngeal cancer. Let's see the rationale. Persistent hoarseness of voice that is lasting more than 2 weeks should be evaluated because it is one of the most common warning signs of laryngeal cancer. Let's see the 10th question. Which of the following drug is prescribed for treatment of histoplasmosis? The drug of choice for treating histoplasmosis: option A penicillin, option B chloromycetin, option C amphotericin B, option D streptomycin. The drug of choice for treating histoplasmosis is amphotericin B. The rationale here, histoplasmosis is a fungal infection caused by Histoplasma capsulatum. Amphotericin is an antifungal agent and it is the drug of choice to treat histoplasmosis. The other three drugs are antibiotics. So we prefer amphotericin B as it is an antifungal agent for treating histoplasmosis. The next question. An emergency treatment for an acute asthmatic attack is option A adrenaline 1 is to 100, option B betamethasone, option C adrenaline 1 is to 1000, option D hydrocortisone. An emergency treatment for acute asthmatic attack: adrenaline 1 is to 100, betamethasone, adrenaline 1 is to 1000, and D is hydrocortisone. The right answer here is adrenaline 1 is to 1000 for the treatment of acute asthmatic attack. Acute asthmatic attack is characterized by severe bronchospasm. An emergency treatment of acute asthmatic attack is adrenaline 1 is to 1000 given hypodermically to relax the bronchial smooth muscles. Question number 12. The Helmholtz maneuver which is also called as abdominal thrust. For acute airway obstruction, attempts to option A, force air out of the lungs, option B, induce emptying the stomach, option C, put pressure on the apex of the heart, and option D, all of the above. The Helmholtz maneuver, also called as abdominal thrust, for acute airway obstruction is attempted to force air out of the lungs. The rationale here, the Helmholtz maneuver, also called as abdominal thrust, is an emergency technique for preventing suffocation when a person's airway, particularly windpipe, becomes blocked by a piece of food or other object. The pressure from thirst lifts the diaphragm and forces enough air from the lungs to expel the aspirated materials. So that's why we do the Heimlich maneuver, also called as abdominal thrust. It is an emergency technique used to prevent suffocation when a person airway becomes blocked by a piece of food or other object. The 13th question of the video here, warfarin, comedy toxicity can be treated with option A, phytonadione, that is also called as vitamin K, option B, protamine sulfate, option C, acetylcysteine, option D, heparin. Warfarin, comedine, toxicity can be treated with. The right answer here is phytonadione, also called as vitamin K. The rationale for this question, warfarin, also called as comedine toxicity, can be treated with vitamin K. The vitamin K may need to be re-administered in patient with massive warfarin overdose on ongoing bleeding. So vitamin K is the right answer here. 14th number question. The normal mean pulmonary artery pressure is 10 to 15 millimeter mercury, 15 to 20 millimeter mercury, 30 to 40 millimeter of mercury, and 20 to 30 millimeter of mercury. The normal mean pulmonary artery pressure is 15 to 20 millimeter of mercury. Let's see the rationale. Pulmonary blood pressure is normally lot lower than systemic blood pressure. Normal pulmonary artery pressure is about 14 millimeter of mercury at rest. If the pressure in the pulmonary artery is greater than 25 millimeter of mercury at rest and 30 millimeter of mercury during exercise, it is abnormally high and it is called as pulmonary hypertension. So we choose this answer over other three options. The right answer here is 15 to 20 millimeter of mercury. The normal mean pulmonary artery pressure is 15 to 20 millimeter of mercury. The last question of the day's video, which one of the most following microorganisms is most likely to be the cause of pneumonia in an immunocompetent young child? Which one of the following organism is most likely to be the cause of pneumonia in an immunocompetent young child? Option A, Nocardia asteroids. Option B, Serratia marcescens. Option C, Legionella pneumophilia. Option D, Mycoplasma pneumonia. Which one of the following organism is most likely to be the cause of pneumonia in an immunocompetent young child? Option, the right option here is Mycoplasma pneumoniae. Mycoplasma pneumoniae causes pneumonia in an immunocompetent young child. That's the end of today's video. Thanks for watching this video and please like, share and comment on this video. Don't forget to subscribe Sato Career Online Nursing channel for all AIIMS learners who is going to write exam on September 16, 2018. I again wish you very all the best. Confident is the right way for your success. Keep watching our channel for more videos to be uploaded in the next 5 days that will help all the AIIMS learner to succeed in your exams. Thank you. Bye bye.